Major support for Out to Lunch is provided by the law firm of Jones Walker, established in 1937 with over 375 attorneys in offices throughout the U.S., providing a comprehensive range of services to a local, national, and international client base. JonesWalker.com. And by the Alliance Safety Council, delivering instructor-led on-site computer lab and online training through more than 100 authorized training providers in 31 states and 2 countries. Headquartered in Baton Rouge, Alliance is focused on the future of learning technology and training process innovation for business and industry, for safety and other corporate training needs. More information is at alliancesafetycouncil.org. And by Short & Associates, legal recruiters in Louisiana and Texas. And Orange Theory Fitness, delivering fitness results for a healthier world.
From Mansurs on the Boulevard in Baton Rouge, we're out to lunch with editor of the Baton Rouge Business Report, Stephanie Riegel. It's business, Baton Rouge style.
Hi, I'm Stephanie Riegel. Welcome to Out to Lunch. As you're coming into Baton Rouge on I-10, you can't help but notice that a lot of the new construction these days consists of big, shiny new healthcare facilities. Indeed, the healthcare market is big business in Baton Rouge, and the race is on for market share. And yet we hear all the time about how the cost pressures and challenges facing healthcare providers, both here and nationwide, are so challenging. What's the deal? There's obviously money to be made, or we wouldn't see all this new investment. But what model is working? Joining me today to discuss this and try to answer these questions is Dr. David Carmouche, president of the Ochsner Health Network, which is the accountable care network of the massive Ochsner Health System, the largest nonprofit academic healthcare system in the entire state. David, it's a pleasure to have you here. Thanks for taking
having
time.
Me. Yeah, appreciate it.
And with me in David is Vishal Vasanji, CEO of Relief Telemed, a new telemedicine platform that enables live medical providers to diagnose and even prescribe medication for users of the startup company's mobile app. Through the app, patients can participate in a live video visit with a licensed healthcare provider 24 hours a day at a cost of just $39.95 per visit. Vishal, it's a pleasure to have you here today. Thanks for being with us on Out to Lunch.
Thank you very much. Thanks for having me.
Well, David, I'm going to start with you. Ochsner's had a presence in Baton Rouge for a long time, but in the past couple of years, it really stepped up its game. Just a few weeks ago, it opened a new facility in Baton Rouge, the Ochsner Medical Complex Highgrove, $116 million facility, 5 stories, 255,000 square feet, a micro hospital, and that's in addition to all of the other facilities you have in the capital region. Why now? Why the need in Baton Rouge when we have other hospitals right nearby where the new Ochsner Highgrove facility is located?
Sure, yeah. Well, so Ochsner's been a part of Baton Rouge for 30 plus years. I think, our hospital out on O'Neill Lane, kind of on the east side of the parish, maybe isn't always thought of, given the medical corridor being concentrated in I-10 and Essen, Bluebonnet corridor. But we've had 13 clinics across the area, and I think we just believe that Baton Rouge is a large, important market. It's growing. It's got a strong economy, and frankly, we believe that there is an opportunity to continue to deliver better health care and a little bit more efficient and maybe more convenient health care than has traditionally been delivered in Baton Rouge. So I think, we'll talk a little bit, I'm sure, today about digital medicine and telemedicine. I think our vision is to design an ambulatory, outside of the hospital environment that meets patients where they are, so closer to their home and work, closer to their neighborhood, meeting them with technology and not forcing them to deal with the traffic in Baton Rouge and come to our office necessarily. And so I think, we just see tremendous opportunity, and it's more of a recommitment and an extension of a long-term commitment to the city.
And did some of this opportunity open up when Our Lady of the Lake shifted its model several years ago and became the teaching hospital and charity care provider in Baton Rouge?
I'm not sure that we would. I don't know
Yeah.
that specifically would be the reason. I think at the end of the day, every time we opened a clinic in Baton Rouge, it was full. So every time we open an urgent care center, it's full. Our hospital is largely full. So I think from our perspective, there is a capacity issue still in Baton Rouge. I think people are still looking for more convenient care, more convenient primary care, And certainly our hospital business is a relatively small piece of our total business in Baton Rouge. And so we continue to grow based on the feedback we get from our customers and our patients. And as long as we're getting the right feedback that we're doing a good job, I think we'll continue to commit resources in the market.
Now, you mentioned convenience and telemedicine, and Vishal, this is what Relief Telemed seeks to do. Is telemedicine the way of the future, or is it maybe part of the way of the future?
Yeah, I think it really is. If you look at some of our talking points when we meet with investors or potential partners, consumers are moving online more and more.
Sure.
We're all connected to our phones, to our computers. We all want convenience. Time now is something you can't create, and so it becomes more and more valuable as we have less and less of it. So, with the advent of Waiter, Amazon, Uber, all these companies that are really focusing on saving people time, healthcare, now consumers want their healthcare online as well. And so, if you look at the numbers, only 8% of the visits, general office visits that are happening out there are done with telemedicine. So there's tons of opportunities in this space for people like David and his group and my group as a startup to really all flourish together. And we may be competitors, but at the same time, we also help each other in raising awareness of telemedicine, right? And so the more people are aware of the technology and how you get almost the same level of quality of care, I think we both benefit from it. But
it sure would be nice to have a live visit with a healthcare professional than sit there and Google stuff that scares you to death in the middle of the night, right, when you're afraid that you're dying or something.
And you'd be surprised how quick a typical visit can happen within 5 to 10 minutes, right? Whereas not a knock on urgent cares or physical clinics. I mean, you could take an hour, 2 hours out of your day to go do that. And who has time for that except for, when we're sitting on this show?
Well, so how does it work? Do you employ physicians, or you just contract with providers?
Yeah, so
y'all are just the app.
Yeah,
basically.
we're the technology, but we also have partnerships with clinics and independent providers as well that deliver the actual care themselves. So we're the middleman. We facilitate the connection between the patient and the providers, and then we do the follow-up and the marketing to help the providers build their book of business for telemedicine.
And do you have to get your users to sign a liability waiver that they won't hold you responsible?
There are some consents that the state does make you get, and the lawyers have asked us to get, but we fully cover, fully insured. We actually provide malpractice for all of our providers. So all that is baked into our business model. So the patients there's really no difference between the type of care and liabilities that are associated with our platform versus going into a medical clinic.
Interesting. Now, David, you talked about convenience, and does Ochsner do something like telemedicine, or
Sure.
what is Ochsner's take on something like a Relief Telemed?
Yeah, last year we launched our own version of a direct-to-consumer telemedicine platform where we, now market to our own patients, and we have about 7,000 of our patients who've downloaded an app and have enrolled and have had, several hundred telemedicine visits now that are defined by the patient's need and at a time that the patient wants, and we see that only increasing over time. We use our urgent care facilities and the providers there to actually be our provider network for telemedicine. So if you think about what comes in an urgent care, there's a significant overlap between those types of complaints and visits and what you would be able to handle on a telemedicine visit. So our urgent care physicians and nurse practitioners believe telemedicine theoretically is a disruption to their business, so they want to embrace it and be the providers. So during the day, at least from like 8 till 8, at night, our own providers are on the front line of telemedicine care, doing telemedicine visits, much like you heard. And then at night, from 8 p.m. to 8 a.m., we work with a national network of telemedicine providers to provide those services.
And do you tie into a national network like that, Vishal?
No, so all of our providers are within the state of Louisiana.
Are they?
Yeah,
Okay.
so they're all licensed and credentialed here in Louisiana.
And what does telemedicine entail? Is it they talk to you, they sort of ask you what your symptoms are?
Yeah, so our app, basically, we replicated the in-clinic experience that, from my past ventures. We basically took that whole process and said, let's virtualize it, right? So the same forms that you fill out when you go to the clinics, you actually do it on your phone, but it's a lot quicker and a lot more efficient. And you go through the same process, all your symptoms, and then the providers look at your chart, look at what you submitted, and then go through the same level of questioning that you would if you were sitting there face to face.
They just can't actually touch you.
They just can't actually touch you.
Yeah, but we've got a little bit of a twist on that. So yeah, that is probably the standard way that an encounter would happen for us too. But we also have a relationship with a company called Tyto Care that has built essentially a handheld kit that has Bluetooth-enabled devices that allow us, for example, remotely to listen to a heartbeat, listen to your lungs, look in your throat, look in your ear. And so we are increasingly able to extend a clinical exam actually into the home environment. And so parents with children, it's been fantastic, right? Because, I mean, inner ear, ear infection, kids, has a problem with his ear, a provider is going to have a hard time diagnosing that specifically for sure without being able to look in the ear. Well, now, high definition camera, very easy to use. Patient can position this in the ear, and the provider over the phone can instruct
that is so cool.
the parent how to do that. So there's all flavors of this. The cost is a little bit of the barrier. I mean, the device is about $300, but if you're a family with a lot of young kids and you avoid a couple of office visits or emergency room visits, I mean, it pays for itself. So.
That is fantastic. And are the insurance companies really paying now based on outcomes? I keep hearing this, but when you get your explanation of benefits statement in the mail from Blue Cross, it doesn't say, oh, you didn't get sick this year, right? I mean, they're telling you that you were reimbursed to get your sprained ankle, x-rayed or something.
So yeah, I mean, there is clearly a shift. I think it's being led in the over 65 market. So I think Medicare nationally has been probably the leader in driving value-based reimbursement models. Medicare Advantage, which is essentially the commercial products that are available for seniors, very, very significantly have moved away from fee-for-service. So, for example, we have had a full capitated payment model for 35,000 Medicare Advantage lives for the last several years. We like those models the best because it allows us to be the most creative at solving a patient's problem in the most efficient, most low-cost environment. Because frankly, if I get paid more for a patient to drive across town, take 2 hours off of work, and come to my office and submit a claim than I would on a telemedicine visit, then the financial incentive in a fee-for-service world is to bring them into my office. Well, if the right thing to do for the patient is to manage them over the phone or manage them via a telemedicine visit, these payment models really free up the delivery system to do that. And so we really like it. Now, the commercial payers have been slower, frankly.
Yeah.
And so to your point, I think the predominant payment model is still fee-for-service. They're still paying us transactional fees. What they've added, though, perhaps, is bonuses based on certain quality performance that wouldn't show up in your explanation of benefits, or if the sum of all those individual fee-for-service encounters represents an expenditure less than some target, there's a sharing mechanism back with the provider. So I'd say we're moving that way clearly. 5 years ago, I would have said we were on the cusp of moving into value-based payment. Now I think we're firmly there, and I think most providers find themselves having to play a little bit of both worlds. They have both types of business, and that creates a real challenge operationally, I can tell you.
You're listening to Out to Lunch. I'm Stephanie Riegel. I'm talking to Dr. David Carmouche of the Ochsner Health System and Vishal Vasanji of Relief Telemed. Vishal, you're not paid by an insurance company. Your providers would be paid, or are they? I mean,
Yes, so we have both options.
Does it work the same
Yes, I have
way?
both options. So we actually recently, just within the last 30 days, are testing insurance payment platform. So you can submit your insurance, and the providers would actually go and get paid from the insurance company. And so, as opposed to a $39 visit, your copay may be $20 or $25, and that's the only thing you would pay. So, touching on the value-based care versus fee-for-service, I was actually at a conference a couple months ago, and it was a whole value-based seminar, right, session. And at the very end, a guy stood up and said, "I've made hundreds of $1 millions on fee-for-service because this country is drunk and addicted to volume," right?
Yeah.
And it's very true because there's a lot of now Ochsner is well capitalized and can take on the risk and mitigate all that, but there's a lot, probably majority of the hospital systems and even providers that are out there, they live off fee-for-service, right? So
Sure.
while the shift is happening, I think there's going to be a point where if providers and systems don't get on board, they frankly might go out of business, right? Because they're already operating on low margins, and so for them to take on financial risk, I think the ones that are savvier and more strategic about it, will
Well,
make
right,
it.
then they've got to compete with the Ochners.
They got to compete with the Ochners, yeah.
What I was fighting when I was at Blue Cross a little bit was a notion when I would meet with providers is that, look, I hear that this change is coming, but when it's here, tell me, and then I'll get on board. What they didn't catch was that there's a lot of investment, a lot of infrastructure, a lot of skill sets, a lot of technology that needs to be put into place to allow you to actually manage the total cost of care for a population, manage that risk and not take a bath. So I think Ochsner owned a health plan 20 years ago,
Right.
and so I think it has a lot of muscle memory about how to do this, but a lot of providers I think underestimate how significant a change it is and how they think and how they operate when they go from fee-for-service as a payment model to something else. It's a big change for them.
And it must be interesting for you to be on the other side.
It is,
So it's
yeah.
Well, I think he touched on something that's very important, I think, in the healthcare field industry right now, and it's the embracing of technology.
Right.
Technology as a whole has become so cheap that it's getting more and more affordable, and the healthcare space is really one of the last frontiers to really embrace it and use it for the benefit of driving down the cost of care. And it's happening in right now it's I think systems, providers, the industry as a whole is still trying to figure out what is the best way to use technology in the most efficient manner, right? Because you hear buzzwords like artificial intelligence, machine learning. They have the product TidalCare that does Bluetooth technology. It's still got a relatively high price tag for the general consumer to use. But I think as we get a year, 2 years, 3 years into this, I think some of those stuff is going to get weeded out, and people are really going to see the benefits of how technology is really helping healthcare become more efficient, right? And the consumers are going to benefit, right, because they're getting probably faster, quicker, more efficient care than they're traditionally used to. And again, it goes back to the entities that embrace technology, embrace innovation. Like Ochsner has done it, I think, all in, right? I read something probably once a week about something new Ochsner is doing. So it's been great because they're really pushing the envelope and telling people, hey, you either need to come in behind us and embrace it, or we're going to keep pushing the envelope, right? And so it forces companies like us to really keep thinking ahead, like, okay, if we want to stay in the game, what is the next step we need to be looking at to really because it's all about driving patient care, right, making it efficient.
Let me pick up on that because here's just an example I think your listeners will kind of appreciate that is probably the clearest example of how we're embracing technology. And so the most common chronic condition in the United States seen in a primary care doctor's office is high blood pressure, hypertension. Historically in the United States, just a little over half of the people who have high blood pressure have their blood pressure controlled. Typically, it's done through a combination of lifestyle change, which most of us in Louisiana aren't particularly great at, and medications. Most of the medications are generic. It typically requires patients to come into their doctor's office once, twice, 3 times a year, have a couple of blood pressures checked in the office. They may be nervous, they may be tired that day, they may have rushed across town and sat in traffic, and so you're making clinical decisions based on a couple of blood pressure readings, maybe titrating a drug, and you're seeing them back in 6 months. So with that model, a little over half of the people are controlled. Well, we've redesigned how we manage blood pressure at Ochsner. Now we have a digital hypertension platform. So if you come to see me today and I diagnose you with hypertension, I'm going to give you the option of managing it virtually. And what that's going to mean is when you leave the clinic, you're going to stop at what we call our O bar. It's our version of the Apple Genius Bar, and they're going to help you download an app onto your phone. They're going to give you a blood pressure monitor that is Bluetooth enabled, and we're going to connect you. And then what's going to happen is we're going to assign a health coach that's working with a pharmacist and a care protocol to actually start now managing your blood pressure remotely. So several times a week we'll ask you at home or at work to send us a blood pressure. We'll get on average 6 or 10 of them a week instead of 2 every 3 months. We will engage you in questions around your health, your lifestyle, exercise, your diet. We'll send you prompts about your medications, and we'll titrate your drugs, all without you having to come in to see the doctor. So, patients love it because actually they get a lot of attention.
Sure.
They don't have to come into the doctor's office and pay a copay. And their blood pressure control rates for the first several thousand patients that we've done are about 87%. So I think that's an example of how technology absolutely can transform a very common medical condition, the care for a very common medical condition. So
can drive the cost of care down.
Absolutely, but again, now if the payment model is fee for service, all of those missed office visits are a loss for the healthcare system. So.
So how do y'all get reimbursed for under this model?
So we use this model initially in populations where we have a value-based agreement, right? Yeah. So where we have incentives in place beyond just fee for service, where we've started. Now, as we've developed a track record now, some of the employers are actually willing to pay a monthly fee for this, because the value for them is not only good blood pressure control rates, but it's keeping people at work. Sure. So we're getting some direct contracts with NASA, frankly, with Shell. And a few other employers who are very interested in this. I think, and then some of the payers are actually interested now in starting to think through a payment model to support this, because it not only has better outcomes, it actually saves money in terms of emergency room visits, et cetera. So I just think that's a really good example.
That's a great
beyond
example.
Telemedicine
Absolutely.
of how technology could change healthcare.
Absolutely.
We're actually talking to a self-insured plan right now with a couple 100,000 lives, and they want to partner with us because for them, every claim that comes through is a cost to the company, right? Because there's no Blue Cross that's paying the claim. It's the company themselves that's paying the claim. So if we can deliver to them a $39, $40 visit, as opposed to a $100 visit in a clinic, then that's what the employers and the self-insured plans administrators, that's what they want. So
absolutely.
Again, another example of how technology can take something really simple and really drive down the cost and make it a win-win for everybody involved.
Do you compete? I mean, in theory, at least, with Ochsner? We
probably do, but the reality is that if a patient is an Ochsner patient, they're going to stick to everything that Ochsner does, right? And it makes sense, right? It's kind of like if you're a Southwest credit card holder, you have all the Southwest points, and you have everything related to Southwest. It doesn't matter what specials every other airline is running, you're going to fly Southwest, right? And you're most likely going to fly to the cities that Southwest is going to, right? And so it's a very similar setup where Ochsner has, like he said, he's got 7,000 downloads, but there's hundreds of thousands of people in Baton Rouge that aren't Ochsner patients, right? That we can go get. So again, while we do compete a little bit, there's probably a little bit of overlap. There's a lot of complementary stuff where them raising the awareness of technology helps us, because now people that don't think about it using telemedicine might say, hey, I'm not an Ochsner patient, but I heard about it. Let me check these guys out because I have a relationship with them, or my doctor has a relationship with them.
Yeah, I think it's a great point. I think if you think about that 7,000, right, just to put it in perspective, Ochsner has about 750,000 unique patients. So these, unique individuals that we have an active electronic medical record
Statewide.
chart for them, right? Oh, actually, regionally, nationally, right?
Okay.
So we've got people that come from all over. So 7,000 is a relatively small number. The point is, the market for telemedicine is so big that I really actually don't even view us as competitors in some ways. I agree with your premise.
What exactly does your company, Relief Telemed, consist of physically? I mean, is there an infrastructure? Is there an office?
Yeah, I mean, we have an office at the Louisiana Technology Park, and that's it. I mean, our infrastructure is virtual, really. Yeah, there's not much overhead. Our infrastructure is virtual. The employees that we have that go do sales and do technical support and do all the developing coding. But our providers are all remote. They're all over the state. Our clinics are, the clinics that we partner with are all over the city and all over the state. So we actually don't have, and that's one of the reasons why I kind of switched from the clinic world to a more telemedicine, technology-based world, is the capital that it takes to build a $50-60 million hospital or a couple $1 million clinic. If I put that into technology, I could probably capture the entire state. So while you don't have physical facilities, I can use that money to drive scale and marketing and grab patients from all over the state, right? I'm not confined to a geographic area. So.
And speaking of physical facilities, before I let y'all go, because we're running out of time, but I didn't want to forget about your new facility in Baton Rouge, which is quite something to behold as you're driving into the city. And it was quite a substantial investment that Ochsner made.
Yeah, I mean, it's a $116 million investment in the market. It's going to significantly expand our footprint. It'll be our flagship, outpatient clinic. It's really designed around outpatient care, though. We believe, in the future, we believe the only people who are going to really need to be in the hospital are people who need ICU level care or surgery. I mean, I think you're even seeing hospital at home programs now for patients who have lower acuity things. So we're really investing in the ambulatory environment. It is a state-of-the-art facility. It's a beautiful facility, but it's designed with the patient in mind. The workspaces are shared. It's really laid out very well, and it has all of the technology that has become part of Ochsner's offering now. So when you walk in to the clinic, instead of seeing a reception desk, you see basically kiosks. It's really a very virtual feel. I mean, it's a virtual clinic to some degree, even though it's a big bricks and mortar. So yeah, real proud of it. Will allow us to attract about 65 new physicians into the market in that facility relative to the facility that we had on the other side of Bluebonnet. What's amazing about this thing is that from the time we broke ground to when we got moved into the thing was 14 months. I was joking with the developer of the property. I'm like, we built that clinic faster than I could build a house. It's like, he said, yeah, but you didn't have people working 24 hours a day on your house. So anyway, we're real proud of it.
It's especially a good track record
I
for
think
here,
that's,
right?
That's important, the facilities and the technology that goes into facilities, because we're all used to it everywhere we go. We go to airports, we have kiosks. We're all used to touching technology. I mean, you go to McDonald's now, they have touchscreen ordering of food, right? You go to Walmart, they've got the self-checkout. So I think healthcare is getting there, and it takes people like the Ochners and some of the systems that are like them across the country to really keep pushing the envelope so that people realize, like, oh, I'm used to that kind of stuff, and I can feel comfortable doing with healthcare, because healthcare is so intimate, right? It's something that they have to build a trust with.
Yes.
And so I think that's what a lot of bit of the friction was between the general consumer and healthcare that embrace technology is they're just so used to talking to someone and touching and feeling and being in the same
Because you're
room
talking
with
about
them.
your body
You're talking
at
about
the
your
end of
body.
the day.
Right.
I mean,
Yeah.
that's what it is.
Yeah,
right?
so as more and more of this happens and as the demographic shifts a little bit, I think people get more and more comfortable with the use of technology.
Well, Vishal Vasanji and David Carmouche, this has been such an interesting and informative discussion. Healthcare is the number one issue facing our country, and the challenges that lie ahead are going to require a lot of innovative thought. And you both are on the forefront of bringing about the change. Thanks for sharing your insights with me today on Out to Lunch.
Thanks for lunch.
Thank you very much.
My guests today on Out to Lunch have been David Carmouche of the Ochsner Health Network and Vishal Vasanji of Relief Telemed. You can find out more about Ochsner and Relief Telemed by going to our website, itsbatonrouge.la. The producer of our show is Grant Morris. Our technical producer is Eric Merle. Our associate producer is Peter Raschuti, and our Baton Rouge business consultants are Charlie D'Agostino, Dave Winwood, and Ann Edelman. If you want to know what we all look like, you can find photos from this show on our website, itsbatonrouge.la, and on our It's Baton Rouge Facebook page. These photos were taken by Carrie Hosford, and you can find more of Carrie's photos at carriehosford.com. You can hear this show and past episodes of Out to Lunch wherever you get podcasts, including Spotify and at itsbatonrouge.la. Out to Lunch is a production of INO Broadcasting for itsbatonrouge.la and WRKF 89.3 FM. I'm Stephanie Riegel. Thanks for joining me. I look forward to meeting you again next week around the table here at Mansurs for more business Baton Rouge style on Out to Lunch.
Out to Lunch Baton Rouge is recorded live over lunch at Mansurs on the Boulevard in Baton Rouge. Mansurs is open for lunch daily 11 to 2, for dinner nightly, and for brunch on Saturdays and Sundays. Mitchell Foreman wrote and performs all the music on Out to Lunch. You can hear Mitchell's music anywhere great jazz is sold or streamed, and at mitchellforeman.com. Major support for Out to Lunch is provided by the law firm of Jones Walker, established in 1937 with over 375 attorneys in offices throughout the U.S., providing a comprehensive range of services to a local, national, and international client base. JonesWalker.com. And by the Alliance Safety Council, delivering instructor-led on-site computer lab and online training through more than 100 authorized training providers in 31 states and 2 countries. Headquartered in Baton Rouge, Alliance is focused on the future of learning technology and training process innovation for business and industry, for safety and other corporate training needs. More information is at alliancesafetycouncil.org. And by Short & Associates, legal recruiters in Louisiana and Texas. And Orange Theory Fitness, delivering fitness results for a healthier world.